clinical meaningfulness, I think, is just sort of ubiquitous in the world of medicine and maybe specifically oncology. We see from the podium in papers all the time that our authors, our investigators are describing endpoints in clinical research and clinical trials as being clinically meaningful. And sometimes that corresponds with a statistically significant outcome, and sometimes it doesn't. Sometimes a clinically meaningful outcome from the podium is measured in days or weeks or months or years. And so, as a perhaps jaded member of the audience, I think that we all sit back and think, but what does that mean? What is clinical meaningfulness? And so I think the goal of this research was really to dive in and see how different members of the collective view that language. Because, not only do we engage with our patients living with cancer, but also their caregivers, and not just physicians, but nurses, nurse practitioners, other members of the care team. And I think all of us interpret what a meaningful outcome is differently. In the research itself, we defined clinical meaningfulness based on some work that led into this as the practical and applied value or importance of an intervention, and is related to whether or not treatment results in a clinician observing a real change, or if a patient has self-reported a meaningful change in their daily life as a result of the treatment, such as an improvement in patient symptoms or functioning. I think clinical meaningfulness is different for all of us, and I think it's different in different scenarios. So if, for example, a cancer treatment is going to extend life, and as a result of extending life is going to cause a certain amount of side effects, the question will be, how does that scale balance? If it extends life 3 days, but carries a 50% risk of grade 3 diarrhea, is that worth it? Is that clinically meaningful to the patient? And my guess is that a lot of patients would probably say no. Whereas if a intervention improved life, extended life by 20 years and had a 2% risk of grade 3 side effects, I think most patients would probably say that's clinically meaningful. Obviously, most of our cancer therapies in the metastatic setting don't improve survival by 20 years. So it's important that we talk about what that looks like. Is improving survival by weeks or months worth it? I'm putting air quotes around that, if it comes with this or that set of side effects. And I think that for every patient at every time point in their disease course, that has the ability to change, because our goals and wishes will change as we experience life, as we go through treatment, as we accumulate experiences living with our diseases. And what's important is that as clinicians, as caregivers, we continue to have those conversations to understand how those viewpoints are evolving.